And I think as you progress forward, there's just constantly a continual evolution where, providers as well as ourselves are trying to figure out how are we going to use AI, how are we going to automate things, how are we going to predict what might get denied.
Yeah. Welcome to Revenue Cycle Above the Bottom Line, the podcast where we dive deep into the world of revenue cycle management. I'm your host, Tim Reiner, and in each episode, we sit down with industry leaders, innovators, and experts to explore challenges and strategies shaping the future of healthcare revenue cycle. Whether you're a seasoned professional or just starting out in the field, this podcast is your space for thought-provoking conversations, actionable career learnings, and discussions about the latest trends you need to know about. Thanks for tuning in, and let's get started. Joining me today is Louis Katz, Vice President of Revenue Administration Services for AdventHealth Information Technology. In this role, Louis provides leadership oversight for teams that support IT solutions, including revenue cycle, patient flow, and environment management. Louis, thanks so much for being on the podcast today. I really appreciate it.
Yeah, I'm glad to be here.
So tell me a little bit about your role at AdventHealth and your areas of oversight.
Sure. So I am Vice President of our AIT teams and have oversight for all of the organization's revenue cycle solutions, patient flow, our environment management team for our Epic solutions.
What does that mean, environment management?
Yeah, that's basically all of the domains for our Epic environments to keep them up and running.
So what are the primary areas your team supports in the revenue cycle that are of like the most key importance?
Yeah, I mean, everything from, I think as you know, but we have our front-end revenue cycle, related to registering patients, doing pre-auth, getting prior approvals, to scheduling of the patients, to middle revenue cycle of coding and all the HIM work, and then obviously the back end of the revenue cycle and processing of the claims, getting payments done, working with patients to resolve issues, collaborating with our partner teams to basically collect the money, handle online activities.
So give me a little bit of history about how you ended up in healthcare. Did you come from a family of healthcare practitioners, or what's your origin story in healthcare?
Yeah, so coming out of school, I was actually a finance major and was going down a path of banking and finance and had an internship summer before my senior year and started realizing I don't think that banking finance is where I want to go. Came back my senior year before really recognized that I want to go into something different. So I actually went down a path of dropping all my finance electives and taking computer programming courses.
Okay.
Not because I wanted to be a programmer, but some of the top jobs, that was really what was required. So I was able to connect with and get a role with a large IT computer company called EDS, which is a Fortune 100 IT company in the early 90s. And at that time, I started in an IT healthcare setting in downtown Boston, Massachusetts. Okay. So I really started in IT healthcare straight out of school.
I remember EDS being like it was Florida's Medicaid intermediary back in the day. Like, I mean, and this is like late 90s, but I think maybe they got acquired and whatnot. So I do remember they were involved in a lot of running Medicaid state programs.
Yeah, and that's actually where I went to. So in the state of Massachusetts, it was a account that was involved with what was called Mass Revs.
Yeah. That
basically did online eligibility in the late 80s, which was state of the art, and then really progressed in my career from there into Rhode Island, where we basically ran the Medicaid program for Rhode Island and then the Medicaid program for Connecticut.
Okay.
So we were basically processing claims for all the vendors for the Medicaid program.
So how did you get from like that sort of intermediary environment in healthcare to the provider side at AdventHealth?
Yeah, so I ended up, was in the Northeast after school and got recruited to Ross Perot's second company, actually, which was called Perot Systems. And that was here in Orlando. And then worked for them for a while, doing IT leadership. And actually, along the way, met a director from the Central Florida division that worked in IT. She was trying to kind of recruit me to come work there. We were trying to recruit her to come work at Perot Systems. And then eventually things worked out where I joined. She won. And I basically came to AdventHealth 23 years ago.
Can you recall kind of a pivotal moment of your healthcare provider IT career that does anything stand out?
I mean, I think one of the probably most exciting things for me was when I worked at Perot Systems. I had finished up a very large scale project where I had about 40 of us traveling, and I was the account executive on it to a location called Harvard Pilgrim Healthcare in Massachusetts. And we were working with all the top executives. I reported to the CIO of that organization in a matrix fashion. Anyways, things went very well, and at the end of the project, the account executive on the Perot side actually brought Ross Perot to come thank me personally. And then my wife was pregnant with our third daughter at the time, and he asked me to thank my wife. And so that was a pretty humbling experience for those that held Ross Perot in high regards. I remember being really nervous and shaking his hand and basically just being pretty much numb. So it was a little bit of a brush with fame and a professional combination all in one.
And so for those people that were born after the year 2000, Ross Perot was a presidential candidate in the 90s, and a rather successful third-party candidate and entrepreneur from Texas. So that's very interesting. So tell me a little bit about a couple of accomplishments like in recent years at AdventHealth. Like, have there been any big key moments like recently in your kind of healthcare IT career on the provider side?
I think then transitioning to Epic has been huge for the organization. And I think as we reflect back, myself, my team, we really have appreciated the stability that we have found in Epic.
Yeah.
And I'll call it the eloquent nature of when things do go wrong in the Epic system, it recovers very eloquently.
Yeah, that stability has been very important. So what's something that keeps you sort of drawn to the revenue cycle space? Like what do you sort of appreciate about it?
Yeah, I think it's been great working with all the different areas. I've had the opportunity to spend about 11 years over in operations when I was at the Central Florida division. And so I'm very process minded, and I've really found that there's a lot of opportunities of partnering with the clinical team as well as really the revenue team to work together to achieve results. So I think it's kind of a combination of really leveraging all of my experiences and partnering with my leaders and team to really figure out how to make things more efficient and at the end of the day, make a difference for our patients.
So we have some listeners that are just entering into the workforce, and you've been in the workforce some 25, 30 years, and you mentioned you have a daughter that's just entered the workforce. Like, what would be some advice you would give to someone that's just entering the workforce, specifically in healthcare, and like some habits that would like garner them success?
Yeah, I think some of the largest counsel that I would have for someone is no matter what you're doing, whatever role that you're in, that needs to be your focus. And obviously you should seek out mentors and always be looking to grow for the future. But I think sometimes people can get so focused on the future that they don't pay enough attention to their roles and responsibility right now. So that would probably be the number one thing is do amazing results for what you're doing right now, supporting whoever you're supporting, whatever your responsibilities are. And that to me will basically be how you are successful and grow professionally.
Are there any mentors that mentored you that were particularly impactful?
Yeah, I think of a couple people. The first leader that I had was at this company, EDS, when I was a leader of leaders, sticks out for me. And one of the stories that I'd probably tell was, I remember this one time in particular, we were in a very large company, like 100,000 people, Fortune 100 company, IT company, and they came out with a policy that was nobody could get raises anything sooner than 15 months and 5%. And at the time, we were trying to build a team, and my peer and I, we were pretty frustrated and upset, like we are not going to be able to build and retain a team with that. And my director at the time basically said, look, we are going to go talk to corporate, put together a plan, and see if we can get an exception. And I'm thinking, hey, we are a Fortune 100 company. There's no way that that's going to happen. And we actually were able to put an entire strategy together, and we basically got exceptions. And it just really showed me that we're in a large organization at AdventHealth, but sometimes you basically can put together a plan, and you need to at least try. Whether it's in your professional life or personal life, you just need to try. And so that was something that I learned from him amongst many lessons. And then I think another lesson that I learned as I reflect back, I think of my time here at AdventHealth, literally over 20 years ago, I remember being in close sessions with Lars Hohmann and myself, him, and my leader, and just listening to him with the way he would talk about our competitors, talk about the departments that we might be working with to do process improvement with, and just how respectful and humble he was as he talked about change that we might be implementing. And so those are two people that stick out for me.
Mentorship's so important. Are you doing some work to mentor others at this point in your career?
Yeah, I do. I usually will spend time with 3 or 4 people a year, and then often I'll get referrals from friends or family or coworkers to see if I can help somebody. So that is something I actually enjoy doing, both formally and informally, trying to help people.
Yeah. You have some pretty amazing hobbies. You've run a marathon in every state. You got to spend a good bit of time outside of the office to do that, I think. But I know you have a significant presence in your career. How do you sort of achieve that work-life balance with all the initiatives and projects going on, and then taking some time for yourself and your family?
I mean, I think it's definitely a struggle. Work can definitely be intense, but I think the key, my wife taught me many years ago, she was always a morning person, and I was always more the night person.
Yeah.
And so I kind of over the years have switched to, I have to be a morning person if you want to get stuff done, at least in my world. And so that's what we do. And so we basically get up early, we run, we work out, we do a lot of stuff in the morning, and then really try to do what I can on the weekends to kind of shut it down, and try to be with family and be out in nature and doing activities.
Before we continue, we wanted to thank you for tuning in. If you have questions or thoughts or just want to say hi, we'd love to hear from you. Send us an email at revcyclepodcast@adventhealth.com. That is REVCYCLE podcast@adventhealth.com. If you enjoyed this episode so far, be sure to like, subscribe, or follow so you never miss a new episode release. Now, let's get back to the rest of the episode. So let's transition a bit from to your current role and talk about like the collaboration between revenue cycle and IT. So from your perspective, what are the key factors in that successful revenue cycle and healthcare IT collaboration?
Yeah, I think for me, I really feel like it starts with relationships and the culture. So I think that you've done a great job building a culture with your team, and I think I've tried to do that with our team and leaders, and then build those relationships so that if something goes wrong, you can pick up the phone and call me, or your leaders can pick up the phone and call me, or anybody on our team. And so I really feel like the collaboration starts with relationships and trust.
Yeah. So what technologies do you think have had the biggest impact in improving rev cycle just in the last 5-10 years?
Yeah, I think in terms of where we've been, I think that a lot of the I'll call it legacy automation. I think really the bot technology has come on strong of being able to automate some activities that are replicating people tasks, so to speak. And I think, really as we look to the future with, generative AI and other things along those paths, it's going to be even really taking things to the next level.
Yeah. What about, in your career, you probably had electronic claims start to be a thing, and you were talking about electronic eligibility. Are there areas within like the clearinghouse space or other electronic transactions that you've seen a big change over your career?
Yeah, I think as I mentioned, when I first started, we were doing claims processing, and in the early 90s, I think when we first got to Rhode Island, their entire eligibility, believe it or not, was still on paper. And so they literally had these tub card files, is what they called them. There was about 300,000 paper index cards, and people would call on the phone, and they would look them up.
Paw through the boxes.
They would. There was literally like 100 people and old school phone lines. And so we basically took that and we automated that and got it into an IT system. And I think as you progress forward, there's just constantly a continual evolution where providers as well as ourselves are trying to figure out how are we going to use AI, how are we going to automate things how are we going to predict what might get denied?
Yeah.
So maybe we can fix that before we send it out.
Right.
How do we tighten up the processes during registration and scheduling
So
to
avoid-
further avoid denials? So I really think that the technology is hopefully going to avoid us making mistakes and really be more preemptive
Yeah.
with getting payments the first time.
What are some of the main challenges you face when kind of aligning the IT initiatives with revenue cycle priorities, and sort of how do you sort of work through them?
Yeah, so I think on the positive side, there's a lot to do.
Yeah.
I think that you and your team keep us on our toes,
Yeah.
I would say, with a lot of vision and strategies that you guys want to happen. And so I think, again, it goes back to that collaboration. I think it's a constant, how are we going to prioritize all this work? We also have a hunger in our organization for growth.
Yeah.
So trying to figure out how to balance the maintenance, the growth, and the innovation is at times a challenge.
Yeah.
But again, I think it goes back to constantly looking at our prioritization processes, our committee processes, to work together and keep trying to improve those.
Data security and that whole compliance area is so essential these days.
Yeah, so I think within the IT area, a number of years ago, our CIO basically started to invest in an area where we really didn't have hardly any resources. And then basically over a number of years, we built up an entire data security team to include an executive that's focused on that work. So that executive works very closely with all the different teams, including things like doing drills for the IT teams, as well as even our operational areas. So those are things that I've seen. And then I think really we have to basically follow processes. And so one of the things that I know at times can be frustrating for our partners on operations is, as we may look at a new vendor or a new product, taking that through a technology review and really kicking the tires of that technology to understand how does it address data security, and really make sure that we align, because those are some critical path things that if something does go wrong, we have cyber insurance that will go back and audit.
So what innovative technologies are you excited about in the coming several years that are on our roadmap collectively between IT and revenue cycle?
Yeah, I think one of the exciting areas involves various parts of our HR solution. So within there, there's automatic denial letter generation that will start the process there, a number of other automation leveraging generative AI that we're looking forward to leveraging there. And then outside of the AHR, we're also looking forward to autonomous coding solutions and really taking some of what we have today with our current vendor and really taking it to the next level.
Yeah. So how do you see the growth of the physician organization within our company kind of stretching us and our support model and sort of our ability to serve that important population?
Going back to growth, our physician acquisition strategy or practices that we acquire with hospitals definitely there's a lot of growth there. And so
The explosion.
yeah, very much. And so as part of that, we collaborate with them. Sometimes they bring innovative ideas on things that they're doing, and then we obviously work closely with Epic and other teams to figure out how to really keep on top of the latest workflow and things we need to do to stay current.
So looking into the future of how kind of IT and revenue cycle collaboration evolves, like is there anything that your team is working on that kind of brings that future state to life?
There's a lot of different projects and processes that we're working on in collaboration with your team to basically, everything from prioritizing of work to really figuring out how to do it right the first time and make sure that when we implement things that we're not having any defects or incidents. So those are some of the process related changes that we're working on and collaborating with your team, really to make sure that we do it right the first time and make sure that we meet the requirements.
Those couple of AI examples, are those generally like language model driven, and sort of how do you feel that we're doing as far as the governance of those sort of AI elements?
Yeah, so I think that the AI journey for organizations, including ours, is exploding right now. And so there's been a lot of different committees. We started one up in RevCycle to get organized, and then the organization is now evolving their own AI governance. We've recently appointed an executive within AIT and for the company to lead out on AI. So really, quite frankly, we're on a journey of learning as an organization and getting organized around the governance, because really AI can be an amazing thing, but if it's not tested and validated and constantly monitored, it could also be dangerous, where it could be a place that security flaws can be taken advantage and create some havoc. So we really got to make sure that we have good controls in place and auditing.
Yeah, I think we're starting to think about those things. I think there's a lot more, to be done and learned, as both the IT professionals and the management gets comfortable with the technology and learns more about it. As you think about our kind of journey from world-class revenue cycle to even becoming a preeminent revenue cycle, what does that mean from your perspective and your role in IT?
Yeah, I think the way that I've come to appreciate it through the years is it's either hitting that top quartile, top decile in performance compared to peers. However, I think I've had a number of CFOs through the years really challenge me and say, maybe it's not always top quartile, top decile, because they're not performing as strong as we want to be.
Yeah.
So there are some metrics where we may be literally off the chart good, or had been. And so that's kind of where we've got to be careful of probably no less than achieving top quartile, top decile, but not always just settling for that, because there are certain performance categories where we may be the number one in the whole country. And so we really got to make sure that we set goals appropriate given whatever that might be.
So we've had a chance to discuss many things today. If you could leave the audience with the key takeaway from our conversation, what would that be?
Yeah, I think in terms of AIT Rev Cycle, we're excited to partner with you and your team on the operations side, and look forward to really continuing to build upon everything we've done and really continue to achieve great results in partnership to support the company.
Before we wrap up, our previous guest wanted to ask this question. And so if you could be a DC or Marvel character, like which superhero character would you be?
A DC or Marvel character? I don't know. I think I'd have to probably jump at Superman to be able to fly,
okay.
I guess.
All right, be able to fly. Yeah, he's a good stand-in.
And I think that was a straightforward probably what I would pick.
Well, thanks so much for joining me today. I've really enjoyed our conversation.
Yeah, appreciate it.
Appreciate our collaboration. The IT work is so integral to, the complex revenue cycle work that goes on. And so I've really appreciated our friendship and partnership over the years.
Yeah, appreciate it.
Thanks so much for tuning in to today's episode. Please make sure to like and subscribe to be notified when our next episode drops. We will see you next time.